Well, good afternoon, everyone. As we get ready to receive the first shipments of the COVID-19 vaccines, I'm glad to see news today from the federal government, as I've been pushing it on the Premier's table, that these vaccines have to be distributed and allocated based on per capita, and I'm glad we're doing that. Our top priority remains getting the vaccines out to those who need them most as quickly as possible. Our first shipments of a very small number of doses could arrive as early as next week. But we're still very far, and I got to repeat that, very far from having the millions of vaccines we need for mass immunization. The federal government, as I've said in the past, the federal government, they're responsible for what type of vaccines we're getting, how much we're getting, and when we're getting it. Ontario, I can tell you, with the leadership of General Hillier and both ministers, done an incredible job. And yeah, I know you just started, General, but man, did you get off to a great start. Ontario is ready to do their part. And we'll be ready, as we are now, to receive and distribute the first the batch of vaccines when they arrive on our doorstep. And I have to tell you, there's been so much work that's been done. I've seen the work. I've seen both ministers working on it. We had our first meeting on Friday, had another meeting over the weekend, and another meeting today with Cabinet, and we're ready. So I want to thank both ministers for all the work you've done in the past, and General Hillier, again, thank you. And I also want to thank the task force. When we sat down on Friday and I looked at the talent around the table, I was just amazed. We have such great, talented people, as I've always said, here in Ontario, and I have 100% confidence we're going to get the job done. I'll hand it over to General Hillier.
Mr. Premier and Ministers, thank you. And ladies and gentlemen, good afternoon. And the Premier asked me to come here and run an operation with the task force vaccination rollout for Ontario. And one of the things I've learned about operations over these past years in the Canadian Armed Forces is that when you have an immense mission like we have with the vaccination rollout program for Ontario, you take it one bite at a time. You can't eat a whole animal at one time or a whole meal and digest it all, so we are doing exactly that. Our mission is really clear for us. We want to run an efficient and equitable COVID-19 vaccination program for Ontario in order to provide every eligible person in the province with the opportunity to voluntarily get vaccinated against COVID-19. And we believe that's going to go a huge way to helping end the tragedy that we see around us all the time in our normal lives and allow us to get back to whatever perhaps a new normal is going to be. And that's our mission, that efficient and equitable COVID-19 vaccination program for Ontario in order that every eligible person in the province can voluntarily receive a vaccine. We've broken it down into 3 phases. Phase 1 is really, in the military we always say, shoot the 25-meter targets first. Shoot the ones in close, get at the things that are going to be right in front of you right away. In our phase 1, we want to deal with the vaccines that we know are coming in the first quarter of 2021. So even though we don't specifically tie it to that first quarter, it's very close there. We know we're getting 2.4 million vaccines in that first quarter, as was, I think, announced by the Minister of Health before. And we know that they'll come throughout that quarter, but we don't know the exact dates. That allows us to do 1.2 million people in Ontario from those who are eligible. And based on the direction that we've received from the government, from Cabinet, we want to get at the most vulnerable population and then get at the health workers across Ontario who really are vulnerable just in a different way. And in some cases, those 2 priorities are going to mesh somewhat because, for example, when we go at the most vulnerable and we go into a long-term care facility to look after the residents there who have suffered so badly from this horrible epidemic, we are obviously not just going to do the residents that are there with a vaccination program. We're going to have available for the people who work there, the personal care workers, the health care workers, and those essential visitors that are required to look after the people in those homes also. So in our phase 1, We want to get the vulnerable and the healthcare workers, and we know that we will have more demand in those two groups than we will have vaccines to satisfy. So we can't do it all at once, and what we have committed back to the Premier and to Cabinet is that our decisions in the short term, based on when the vaccines arrive, whether it's 100,000 next week or 250,000 down the road further on or 500,000 2 weeks after that, we will make the decisions as to where we go based on the best data that we have. So we will go, for example, towards the people in long-term care homes who are in the hot zones, who are in the lockdown zones, who are in the red zones. And we will go for places where there's congregate living, where there is communal dining, where there is more than one person sharing a room. And we'll go into places where they've had problems with COVID-19 and suffered tragically from it before, and we'll go into places where the Government of Ontario has had to offer their support in the past 9 months or so to make sure that the tragedy doesn't get even greater. And so we're going to do that over that first phase. And we're going to start, we've been working hard to do the planning, pulling together all the incredible work that's been done from the logistics people, from the medical folks, from the information technology folks, and of course for the public communication specialists who are working on how to educate the public as best possible about what the program is and what the vaccine is so they can make intelligent decisions on what they need to do to live a better life going forward from here. And so we've been doing that planning. We've already run one tabletop exercise to look at how we would do things. We will run more. We have participated in 2 tabletop exercises with PAC to ensure that we are in lockstep with them. We have coordinated with the Canadian Armed Forces, 4th Division headquarters here in Toronto, and the staff there are into our planning with us, and we are working through that. We are making sure that we're ready to execute on Phase 1. Phase 1 will take us 2 to 3 months, depending on the arrival of those vaccines. We won't be able to do everyone each day or on the first day, so people are going to have to be patient that their turn will come in that Phase 1 category. Phase 2, somewhere about 1st April onwards, in my view, is going to take 6 to 9 months, perhaps a little bit longer, and that's when the bulk of the vaccines will start to arrive, other than Pfizer and other than perhaps just Pfizer and Moderna. And we will start, and we will ask, of course, the Cabinet for recommendations as to the priorities beyond the vulnerable and the healthcare workers, so we can start ensuring everybody across Ontario who is eligible and who wants the vaccine can get it. And then Phase 3, which we'll be planning at the same time, is what I would call the steady state. And that's when we want to turn the operation into one which is identical to the flu vaccine or the shingles vaccine, where your pharmacies, your medical clinics, your provincial health units are the places where you go, and that the special vaccination sites that will characterize a lot of Phase 1 and a lot of Phase 2 will start to disappear. I'll close by saying we're also going to be shaped by the vaccine itself. And we know that with the Pfizer vaccine, it is perhaps going to be very difficult to move it from the points where we receive it. And so we may not be able to get into long-term care homes immediately. And if we can't, we'll get the workers in those homes to come to the vaccination site where the vaccine is delivered. We'll get them, the personal care workers, the essential visitors, and the health care workers who looked after those, the residents of those long-term care centers. We will get them vaccinated, and then we'll get on with vaccinating the health care workers who can come to the sites where the vaccine is. And as soon as we either can move the Pfizer vaccine, we'll go into the long-term care home and retirement homes and make those special vaccination sites and get at those most vulnerable. Or else if we get another vaccine like Moderna where we can move it and do the same thing, that's what we will start to do. So Phase 1 is using those 2.4 million doses of vaccine of both Pfizer and Moderna, assuming that both will be approved by Health Canada. And we have great faith in the rigorous process that Health Canada is putting these vaccines through. And when they pronounce yes, which we assume they will do, that the vaccine or vaccines are ready to go, I think every person in Ontario should have faith that that vaccine is healthy and right for them. Mr. Premier, I think I can stop right there.
That's great. Thank you, General.
We'll go to the phone line for questions. First question, please.
From Antonella Artuso, Toronto Sun. Please go ahead. Thank you. Hello, Premier.
Hi,
My
Angela.
colleague Mike Strobel has been writing about Variety Village, which is a facility for children with special needs in Scarborough. Most of the services have been closed under lockdown restrictions for fitness centers. Would you consider taking another look to see if just those therapeutic services could be reopened for the kids who need them?
I'll pass that to the Minister of Health.
Well, the answer would be yes, because that is an important service that those young people need to have those services. This is a totally different thing from a gym facility. This is their daily routine. Some of those young people have autism and other challenges, and it's very important as much as possible to keep their routine going as much as one can.
Follow-up?
This is on another topic. There was a lot of discussion and interest in comments made by the Chief Medical Officer of Health last week about proof of vaccine. So I'm asking, would you allow employers or schools or other organizations like long-term care homes to demand proof of vaccine, or will it be completely optional like the flu shot?
Well, right now it's optional. Constitutionally, I don't think we can force every single person to take it. And I just don't believe in forcing people to take this. What I do believe, encouraging everyone possible out there to get a vaccination shot. It's going to protect all of us, but it's also going to get the economy moving forward. It's going to protect our healthcare system. It's going to protect our education system. So I highly recommend that people take the vaccine. I'll pass it to the Minister of Health.
Well, yes, we can't force anybody to take the vaccine, but I agree with the Premier. We really encourage everyone who is able to have the vaccination. It's going to be really important for your own protection, but also the protection of the people that you care about as well. Who knows, there may be some restrictions in terms of travel or other restrictions that may arise as a result of not having a vaccination, but that's going to be up to the person themselves to make that decision on the basis of what's most important to them. But we do wish everyone to receive the vaccination.
Next question.
From Sean Jeffords at the Canadian Press. Please go ahead.
Good afternoon, Premier.
Hi, Sean.
Wanted to follow up with you about the vaccination rollout plan. Specifically, does the province have enough capacity to store the Pfizer vaccine? I understand it requires a very specific deep freezing conditions to be able to store it. Does Ontario have that currently right now?
We do, but I'm going to pass this over to General Hillier or the Solicitor General.
Look, I think, yes, we do. In fact, I know that we do. I was at a company, Aristicus, up near Pearson Airport on Friday night to see what their drug distribution capabilities and experience are, and you walk into their facility and immediately you see 11 ultra-low temperature freezers, and they're not even included in the calculations that Ontario was doing. So yes, we have the ultra-low temperature freezers. You have to remember that when those vaccines come, the bulk of those vaccines is actually very small, and in a box, 16 inches by 16 inches by 22 inches tall, you have 5,000 doses of the vaccine. And so the storage capacity that you actually need is pretty small. Then secondly, those boxes themselves are actually miniature freezers that you can use for 15, perhaps soon to be 20 days by replenishing the dry ice which is packed around those 5,000 doses. So that is a storage capacity in itself, and what we want is for our operation to be so efficient that none of those vaccines are going to sit around for more than the time that we could need to keep them frozen inside those temporary freezers. In other words, that we want to receive it, we want to distribute it, and we want them thawed and mixed and then injected into people who want the vaccine before we're even close to those 15 days and having them thaw on their own. So I think the answer is yes. We're well prepared for that, and in part because Pfizer sends them in really temporary freezers.
Just a reminder for those at the table to pause for a second or two to let the camera adjust. So with that, we'll get to the follow-up.
Thank you, Premier. I wanted to also ask you today about the Auditor General's annual report. She's highlighted a number of things in this report, but I wanted to ask you specifically about her findings regarding funeral and bereavement services. She says that some of the things she found were, in her words, very sad, in that families sometimes in the province are subjected to high-pressure sales tactics, that they can't access clear and consistent price lists for some basic funeral services. So I'm wondering, does your government, in light of this, need to step in and further regulate the funeral and bereavement sector and its providers?
Well, first of all, let me address the Auditor General's report compared to the last time. I love this report because, this gives me the ammunition to sit down with the OPS and to be very frank, my ministers and deputy ministers, and run through the concerns. This, in my opinion, this is a great report. Now, I've out of the 45 pages, I've finished off about 20 pages. It's a pretty in-depth report, but I'm going to follow up with every single minister, and there's some great stuff in there. I'll tell you, great stuff. I'll give you one example. What's in the report on the transportation side. We've been talking about the Hamilton LRT for God knows from the day we got into the office. And the previous Liberal government under Stephen Del Duca, the minister at the time, now the leader, was misleading all of Ontario when he said, no, it's not I think it's 3.6 billion. It was only $1 billion. Well, now the Auditor General came out and confirmed the numbers we have said. The only difference between us and the Liberals, as soon as we found out, we were transparent. Compared to Stephen Del Duca, they wanted to hide it and mislead the people of Hamilton. I love the people of Hamilton. I'm going to be transparent. One way or another, we're going to get the LRT built. We've committed $1 billion. But how can you trust Stephen Del Duca when he was totally dishonest and he knew about it the whole time, that it wasn't the accurate figure? Now the truth has come out, and this is what I mean. The Auditor General's report, I love this sort of stuff because now I can dig deeper into it, and we'll have answers on all of it, because this is the stuff I need. That's the arm of the government that we need holding everyone accountable. That's the reason I got elected. And I can assure you, I'm going through line item by line item. Every minister is going to be dragged in my office along with their deputy minister, and we're going to get some answers. I love this stuff. I really do. It's finally looking at, a waste in a massive organization like the province of well over $170 billion budget. This is the stuff I love. So I want to thank the Auditor General for the great report.
Follow up? Sean?
I think that was
Oh,
his
sorry.
follow-up.
Next question.
Yeah.
Operator, next question, please.
Next question will be from Lucas Meyer of News Talk 1010. Please go ahead.
Hi, Lucas.
Thank you very much. So it's kind of a double-barreled one here. So General Hillier, the 249,000 doses, it's my understanding that about over 48,000 will go to Ontario. So just your best case scenario, those initial doses, when's the best case scenario that those will all be done, the 48,000? And Premier, on that, there's multiple polls suggesting a big chunk of Ontarians are planning to see their loved ones over the holidays. Are you worried you're going to have to come out and say that, lockdowns or repeal in Toronto could go, well into the first 2 months of the year?
What does the general answer the first one?
Well, first of all, Lucas, I don't know when it'll be done because we don't know when we'll get them. We're expecting, I think the figure I saw, this is just calculating as we heard the federal announcement, out of 249,000, roughly 85,000 would come to Ontario. I said, I think on day one when I arrived there, I'd love to get a drib or a drab of the vaccine show up so we could actually test run our system. So I think, I talked about how efficient we want to be, but I think on the first batch that comes through, if it is a number of 85,000, we want to actually make ACE slowly, proof our system, make sure we got it right, still obviously get those vaccines out. So 85,000 gives you 40-some-odd thousand people because you saved the second vaccine that they must get at day 21 out of that same batch. So I would want to say a week to 10 days or so after the batch arrives and is delivered to us in Ontario. But again, we want to get this first part right, and then we will be much more efficient with the follow-on. And so I would recommend that that's what we'll do. But I still think we'll do it fairly quickly.
Well, regarding the holidays, I want to sit down with our health table. We're still a little ways away. We want to see the numbers. I know we're seeing the range anywhere from 1,700 up to 1,900. It's kind of flattened, but we have to make sure that curve goes down, not flatten the curve. So it's concerning. But I go back to the modeling a couple of weeks ago when we saw the worst case scenario being 6,000. So I sat back and thought, if we didn't do this lockdown, would have it been 6,000? So we're going to get the advice off the health table. And you know, the one question I am getting about secondary residence, people wanting to go up to secondary residence no matter where it is. I checked out the guidelines. What I'm going to answer all the people that have been calling about this over the holidays, if you're going to a secondary residence, you get all your shopping, all your food, everything. Where you live, you go up there and you stay there. You don't be leaving your place. You stay there with your direct family members. That's what I have to say to all the folks who have been calling about that. And Minister, do you have anything to add to that?
No, I completely agree with what the Premier has just said, that we want to limit traveling as much as possible. But if you are going to secondary residence and you're going from an area of lockdown like Toronto to an area perhaps like Haliburton, which is much lower level, please do all of your shopping, all of your advanced preparations, and then stay at your place, because we don't want to have more community transmission in those areas that are still very low in terms of positive cases that have already been confirmed. But the other thing is that I know people are looking forward to the vaccine being ready and may see it as a situation that you don't need to take care anymore. You really, really do. Please try to limit your holidays with just members of your own household. Please don't have big family parties. Please don't go to big get-togethers. That just increases community transmission, and we're really trying to get those numbers down so that we can get Toronto and Peel out of lockdown and some of the other areas into lower levels, so that we can start living more normally, whatever the new normal is, again, at that point. So please continue to follow the rules.
Last question.
From Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Hi, Premier. I just had one for General Hillier to clarify something he said earlier, and maybe I didn't hear it right, but I thought I heard something about not getting right into nursing homes until later. So what I'm trying to clarify is will you be going into nursing homes in the hot zones with this vaccine as soon as you get it?
Rob, we don't know yet. Every single day we learn something more about the characteristics and the properties of the vaccine. And one of the things is that the stability data when it's moved is uncertain. And as of right now, we may be restricted somewhat in moving it after we receive it at the various locations around the province. If that is the case, and we don't know all the details yet, then we'll establish vaccination sites right there, and we will vaccinate those who will have to come to the vaccination site, as opposed to taking the vaccine into those long-term care homes right away. And obviously, many of the residents in those long-term care homes, or many of the retirement homes, in fact, could not come out and go to a vaccination site. And so what we would do in that case, we'll establish a vaccination site where we have the vaccine delivered. We will have the people working in those long-term care homes that are, like I say, selected by the data that tells us they're in a hot zone, in a red zone, in a lockdown zone, have a problem, have them come to the vaccination site. We'll vaccinate the people who work there, the personal care workers, the health workers who look after the people who live there, and those essential visitors who are also crucial to the care. And that in itself, as one of the doctors said to us just a day or so ago, will change dramatically the risk to the residents in those long-term care homes. And then we'll use the vaccines to vaccinate healthcare workers and people who work at other homes. And as soon as we can move the vaccines, what we wanted to do is be able to establish special vaccination sites, go into those long-term care homes, and do the residents there, offer them the opportunity to have that vaccine, and make sure everybody is vaccinated and protected as best we can. We may not be able to do it right away. We're planning for both cases.
Follow-up?
Yeah, just to get a little deeper into that. So when you're talking about stability data for the vaccines, from what most of us have seen from a layman's level on television, it's just temperature. So that's the concern. Are there other stability issues here other than temperature? Because, you know, I think some of these vaccines, even the Pfizer vaccine, you know, you're not injecting it at minus 80 degrees Celsius into someone's arm. So how how long can it stay at room temperature? And can you just explain a little, in a little more detail, why you don't think you can take it into nursing homes right away?
So I'll pass it to the Minister of Health.
Well, it's primarily a concern with Pfizer vaccine that has to be stored at minus 80 degrees. So there are over 21 hospitals in Ontario that have been identified as having the freezer capabilities, as well as some of the other areas that the General referred to earlier. So we need to, we're still in discussions with Pfizer to understand whether the doses must be left at that initial place and then people come to where the vaccines are located, or if there is some ability to move the vaccine slightly. They have a shelf life when refrigerated of up to 5 days. So we need to get that final information to understand whether the Pfizer vaccines can be taken to long-term care homes, or whether there will be a need to wait until the Moderna vaccines come on board, which are more stable and only need to be stored at, I believe, 2 to 8 degrees, something like that. So there's a big difference in the different types of vaccines that are available, and the concerns are mostly with respect to the Pfizer vaccine.
And the General will follow up.
Rob, I know how to run operations, but I think I've told you about 110% of what I know about vaccines. So I'm listening to the experts, both the manufacturers, and obviously we will be guided by Health Canada in its approval process on the drug. And when we know that we can move it, what we want to do is get to those most vulnerable people first. Obviously, long-term care homes in those areas that we've already discussed are crucial in that. And until we can move it there, we will set up vaccination sites and do all of those others to help, obviously, increase the level of security and health for those in those homes, but also get the other group, the healthcare workers, vaccinated. So we go by the advice and the counsel and the knowledge that comes from the manufacturer and, of course, Health Canada once they approve the vaccine.
That's great. Thank you, everyone.
Thanks, everyone.
Thank you.